Got it. Should be good. Good evening and welcome to the Insurance and Pharmaceutical Subcommittee of the Health and Government Operations Committee. As you can see, this is what we call crossover week, and the schedule is extremely unpredictable, and we have meetings throughout the day. So thank you for your patience and indulgence. We are talking about two bills today. We are going to vote on two bills today, House Bill 815 and House Bill 1217. And we're going to start with House Bill 815, breast and lung cancer, establishment of a screening and awareness program, and insurance coverage and cost sharing. Lisa, everyone has a copy of the reprint. Can you tell us what the amendments do in the reprint?
So the amendments strike requirements for the department to establish a new program, and they strike the breast cancer screening mandate. They also clarify the language regarding the high deductible health plans. The amendments also, they require the department to conduct an assessment on current outreach, education, and health disparities in cancer screening and report back to the Health and Government and Finance Committees by December 1st, 2023 on its findings and recommendations. And for everyone that is concerned about the assessment language having biomarker screening instead of biomarker testing, in the version the full committee will vote on, that has been just changed. I just sent out what I sent out yesterday, forgetting that I had made that small change in the official amendments.
Okay. Is Delegate Fennell here?
Hi, are you looking for Delegate Fennell?
I am. Is she here?
I'm sorry, I'm still on the floor. I took the call from the floor. So are you, what's the question? She should be hopping on momentarily.
Just wondering, if she had any comments, thoughts, reactions as the sponsor of the bill.
I don't want to speak for her. I think she's hopping on. I'm really here for 1217, but I think that she wanted to make sure she wanted to make sure screenings were still intact and kept in the bill some way.
We just renamed it to be testing, not screening.
I'm sorry, say that again one more time for me.
We renamed it to be biomarker testing. It's they're not actually screening
In 815?
In 815, right.
Okay, hopefully
So
she'll
just-
be on because that's what
right.
she just told me.
Okay.
Oh, I'm sorry, she's calling me, Madam Chair.
Okay. Well, while we're waiting for her to get on, I'm going to go to Kathleen Longren.
Thank you, Madam Chair, committee members. Kathleen Lochran with WellPoint and MCO in Maryland. Sorry to interject at the 11th hour, but I do have a concern with the amendment that showed up today that caught my eye, and that is, of course, the cross-reference to the Health General article. I had a brief conversation with the department, and they understand the concerns. If in
I think this one is, I think you're on the other bill.
Am I on the wrong bill, Lisa?
Are you looking at 815, Kathleen?
I think you're talking about 12, the other bill.
Am I talking about 12? Okay, then let me just hold my remarks. I came on a few minutes late, so that's the bill I thought you were on.
Okay.
So my apologies. I'll
On
wait.
815.
Yep.
Danielle Valerian.
Thank you, Madam Chair. Danielle Varanian. I've been working with Delegate Fennell on this bill, and I just wanted to reiterate the same concerns that we have from yesterday, and that's that with the removal in its entirety of the breast cancer diagnosis portion of the bill, what we've done is in the Komen bill, which is House Bill 376, that bill doesn't include diagnostic image guided biopsy. So that's our concern with respect to this bill. But from the other amendments that we've seen, Madam Chair, with respect to like the work group, we think that that's a great idea and we would be supportive of that and just would love the opportunity to participate in it. But again, our only concern is that image guided biopsy.
Okay. Delegate Tavares, could you please mute your computer? Thank you very much. I have spoken with the Speaker Pro Tem, and we are going to add a study. Typically, when we do new insurance mandates, we study what the costing impact will be before we implement it. So, as you saw in the Speaker Pro Tem's bill, we know that that bill is going to cost about 83 cents a year in terms of premiums. We don't, the biopsies are going to be a little bit more, but we don't know how much. And so during the crossover period, that bill will be amended to include an MHCC study of the cost impact for image resonance biopsies. So it's covered. We've got it. Thank you. Thank you, though. Matt Celentano.
Thank you, Madam Chair. I am sorry, I couldn't figure out which bill we were on either. I had some audio issues, but here we are, 8:15. So I want to thank Lisa for all the work she's done, and thank you for the reprint. We do have an issue. The carriers have we have some opposition to parts of this bill. On the amendment on page 4, line 34, that adds the language about any other screening methods recommended by the preventive task force. This is sort of an 11th hour change. This was never part of our discussion with the stakeholders, and it was never part of our favorable position on the bill at the hearing. We are very much concerned about the cost impact of this. It's very broad. So for the record, without knowing what's being pulled in, and without a mandate assessment, it's very hard for us to say what the premium impact will be on the amendment now and over time. So it makes us extremely uneasy that I can't even respond with specifics about the time to have the carriers analyze. I mean, this is something that I can't pull out of a hat to get an impact statement, so to say. So and provisions that increase cost drive patients to high deductible plans. And I just want to flag that concern for the committee now and for the future. We want folks to have the proper coverage, but we don't want to have last minute amendments like this that could blow up the affordability provisions.
Okay, thank you. Thank you for that. Delegate Fennell, would you be, I understand, Matt, what you're saying in terms of this is, I look at it, seeing it as extremely broad. And so Delegate Fennell, would you be amenable to removing on line 30, wait a minute, where is it? Oh, it's down here. On line 34 on page 4 of 5, and any other screening methods, all of that section, and so put a period after biopsy. You're on mute. There we go.
And you said put a period behind biopsy?
Yes.
I would be fine with that.
Okay. Can somebody move the amendment to strike lines on line 34, the words beginning with and ending with force?
Move to strike the line.
And
Second.
Can I have a second? Will there be any objection to that striking? Seeing none, I think we're good. Delegate Fennell, do you want to speak to the bill at all, or are we ready to rock and roll?
I do. I'm not going to hold you guys. It's Friday. I just want to say thank you all for the committee and everyone that is that doing the job of what you're doing. And I appreciate you all so much. And I just say thank you.
Well, thank you. Thanks for bringing us the bill.
Madam Chair.
Can I have a motion on the amendments?
Madam
in the
Chair.
reprint? Oh, I'm sorry, Delegate Johnson.
While you have her, do you want to ask her if she's good with the changing the word to testing?
Oh, thank you for reminding me. So we discovered that biomarker tests are not really screening instruments, they're testing instruments. So we just changed the word screening to testing, and you'll see will be in the final reprint.
That'll be fine because
Okay.
I'm very familiar with that.
Okay.
Thank you.
All right. Can I have someone move the amendments in the reprint?
So moved.
And
Second.
Second, it's been moved and seconded. Any further discussion on the amendments? Seeing none, those in favor of the amendments, please say aye.
Aye.
And any opposition to the amendments? Seeing none, can I have a motion on the bill as amended?
Motion amended.
Okay, it's been moved and seconded. Any discussion on the bill as amended? Seeing none. Those in favor of the bill as amended, please say aye.
Aye. Aye.
Will there be any opposition to the bill as amended? Seeing none, it is unanimous. Thank you all. Thank you all for your work on this. I know folks were really working behind the scenes. We're going to move to 1217, and same thing is happening here. Lisa, I don't know if you or Marie Grant want to tell us about the changes in House Bill 1217.
All right, I can briefly run through it and then she
Okay.
can probably go into some more detail.
Okay.
So the bill requires health insurance carriers and Medicaid, including managed care organizations, to provide coverage for biomarker testing for the purpose of diagnosis, treatment, appropriate management, or ongoing monitoring of a disease or condition that is supported by medical and scientific evidence. The amendments change the sponsor, they delay the implementation of the Medicaid provisions until July 1st, 2025. They clarify the definition of biomarker testing. They strike language that would have included coverage for testing supported by specified consensus statements, strike language on prior authorization, require the Department of Health to issue a report by December 1st, 2024 on the fiscal impact of biomarker testing under the bill, any data on the use of biomarker testing by race and ethnicity, and the anticipated fiscal and access impacts of expanding coverage requirements for biomarker testing under Medicaid. And the amendments also require the Healthcare Commission to study the impact of biomarker testing coverage, including an analysis of the image of providing access to biomarker testing to individuals based on race, gender, age, and public or private insurance.
Okay. Marie Grant, do you want to add anything there?
Not much, just that we're really grateful to Delegate Wilkins and Delegate Tolles for working with us. And I think we got to a place where with that delayed effective date and the study that Medicaid will do and sort of the ramp up of experience, we could be much more comfortable with the bill. So we're thankful for all the work that's gone into it.
Thank you. Thank you for working with the delegates. Delegate Tolles, thoughts, feelings, feedback?
Thank you so much for all of your assistance. I will defer to Madam Chair, as this is a priority for the Legislative Black Caucus of Maryland. But I thank you, Madam Chair, for your patience and everyone else.
Thank you for your work. Delegate Wilkins.
Madam Subcommittee Chair, thank you so much for the work on this bill. We hope, this back and forth didn't cause too much time and energy.
Just delegate here. Sorry.
Oh, I think we lost her.
We are just, we just want to really thank you all for your time.
There we go.
The Maryland Department of Health and all of the stakeholders have been able to convene today to come up with this agreement, and we are in full support of the legislation as amended, and just grateful for the carriers, grateful for the various stakeholders that have come together to make this bill work. So thank you so much. We appreciate it.
Thank you. Thanks for your work. So Kathleen Longren.
Yes,
Now,
thank
I
you,
think
Madam
have-
Chair. Yes, thank you. And listen, I'm not interested in slowing down this bill. I think it's an important part of piece of legislation, and everyone has worked really hard to get to a place of agreement. But, as usual, I do have a problem with the suggested cross-reference to the Health General. It's an amendment that was added at the beginning of the bill. And I would like the opportunity to work with MDH, perhaps when the bill crosses, so that when the study ends, at that time, it can be determined that the department would adopt regulations or provisions in statute vis-a-vis biomarker testing by MCOs. I'm not objecting to doing the testing. I'm objecting to having the insurance commissioner regulate us, given that this is something that would be in the Medicaid program and would have federal oversight as well as state oversight.
Yeah, I think I've heard those issues before.
Yeah, I mean, I'm happy to try to do it quickly now, but I don't want to slow the bill down. So, I just want to be upfront with everybody. It's something I would like to try and work on when it gets to the Senate, if we don't have time to do it now.
Lisa, is there a simple way to do it?
I'm gonna have to talk to a couple. I mean, I don't.
Okay.
I mean, my suggestion would be in the study, maybe you could put a reference there that at that time, it would be determined to.
I mean, that if the department is okay with that, I guess we could add it in there.
Marie, what do you think?
That sounds fantastic to me.
Okay. Lisa, can you give us words that and where they would go?
I mean, can we do it conceptually, and I will run it by Kathleen and Marie before it goes to the floor?
Is that without objection? That's from the committee? All right, then that's what we'll do. Thank you.
Great. Thank you.
Lisa. And thank you, Kathleen, for bringing that to us. Ann Seacott.
Thank you, Madam Chair. I mostly wanted to just thank everybody for working together to find good common ground. Lisa's been tremendous in everything she's been able to do, as always. I actually am just a little unclear about what was just agreed to, because I thought I heard one thing, but it sounds like maybe it wasn't. So are we just talking about sort of a technical issue that there's a problem with the cross-reference, or is it something different than what we have agreed to related to a delayed implementation?
And it's my understanding that, I mean, Kathleen is concerned that because of the cross-reference that MCOs are being regulated under the insurance article and possibly subject to oversight by the commissioner. So we are going to put in the study language for MDH, just something that after MDH finishes their study, should there be language added to the health general article specific to MCOs? Does that about summarize it, Marie? Kathleen?
Marie?
Yes, I think,
Oh, Kathleen, go ahead.
and we're not trying to avoid regulation. We want a regulation in the appropriate place, which would be MDH, not the insurance article.
Right. Yeah.
That's right.
Like, and I think it's almost even just how you draft it and like moving that language, like the copy and the paste into health general. Right. So, but not wanting to slow this down, just given the timing.
Okay.
Then I'll go back and say thank you very much to everybody.
Thank you, Ann, for paying attention. So with that, can I have a motion on the amendments?
Move the amendments.
I've got a movement and second. And do we have any discussion? Any further discussion on the amendments? Delegate Tavares.
Yeah, I just wanted to make sure that I'm clear where we're looking at. The way I'm looking at it from what we're walking away is that we're going to be looking at section 2 and section 3 on page 5. Is that where we're looking to insert this new language? Lisa?
Yes, it will be in the section 2.
Right.
Yeah, that's what I wanted to confirm. Okay, thank you.
You got it. Thank you. Any other questions, discussion? Seeing none, those in favor of the amendments, please say aye.
Aye.
And will there be any opposition? Please raise your hand. Seeing none, amendments pass unanimously. Can I have a motion on the bill as amended?
Amended.
A few people moved it, and I think there's a second in there someplace. I've got a motion and a second, and the bill is amended. Any discussion? Seeing none, all those in favor of the bill as amended, please say aye.
Aye.
Will anybody be in opposition to the bill? Seeing none, the bill as amended passes unanimously. I cannot thank you all enough for the work that you did to make these two bills come together and into consensus documents. So in a short time frame. So thank you all. I know Lisa, Marie, Delegate Coles, Delegate Wilkins. I know everybody was working on this, and into the evening last night, so and early morning. So thank you all very much for your work. We will adjourn this meeting and go into a voting session for HGO. Thank you all and have a good evening.
Thank you.